It would be a real advantage to be able to identify factors associated with occurrence of stroke and systemic embolism in patients with atrial fibrillation. Now in circulation, researchers report on the use of data from the ROCKET-AF trial, which randomized 14,000 patients with nonvalvular AF to rivaroxaban or dose-adjusted warfarin. The researchers then used Cox proportional hazards modeling to identify factors independently associated with the occurrence of stroke or non-CNS embolism. Then they developed a risk score and validated it in ATRIA, an independent atrial fibrillation patient cohort. Now that's a lot of work, but the findings are relevant to our daily evaluation of patients at risk for stroke. They found that over a median follow-up of nearly 2 years, 4% of patients experienced primary endpoint events. And here's the central, somewhat surprising conclusion. Reduced creatinine clearance was a strong independent predictor of stroke and systemic embolism, second only to prior stroke or TIA. Not surprisingly, additional factors associated with stroke and systemic embolism included elevated diastolic blood pressure and heart rate and vascular disease. Their findings indicate that stroke risk scores such as the CHADS and CHADS-VASc scores should also include estimated GFR. Bottom line, in patients with nonvalvular AF at moderate to high risk of stroke, impaired renal function is a potent predictor of stroke and systemic embolism in the future. When you evaluate stroke risk in your patients with AF, include renal function. I'm Peter Block, and this is a CardioSource Heart Minute.